thank you for your introduction. I'm Gabriele, and I'm a nutritionist and a PhD student of the University of Turin. So this is my presentation. So very briefly, NAFLD is the most common cause of chronic liver disease, and its prevalence is increasing and now stands at 38% of general adults population. Its treatment is based on the acquisition of a healthy lifestyle, based on the adherence to the Mediterranean diet and physical activity leading to weight loss. And we know that NAFLD is a multifactorial disease, and sleep disturbances are common in patients with NAFLD and also may interact with other factors. So sleep pattern, in fact, may influence circadian rhythms, which are endogenous to our body and play an important role in our biological function. And here on your left, we can see a schematic representation of the organization of circadian rhythm. And briefly, we know that our retinal ganglion cells detect ambient light and activate the master clock, the suprachiasmatic nucleus, which in turn modulate other networks such as the feeding fasting rhythms, the sleep wakefulness homeostasis, in the hormonal rhythms. Animal evidence show that a desynchrony in the circadian rhythm may increase the risk of NAFLD pathogenesis by increased lipid dysregulation, oxidative stress and inflammation, and through impaired glucose tolerance. And also, in a cross-sectional study with 172 adults from the OBRA study, a poor sleep quality was associated with increased BMI and waist circumference and a lower adherence to the Mediterranean diet. So our daily lives are controlled by 3 clocks. The first one is the social clock, which is the local time. Then there's the sun clock that exists in Earth, establish its rotation, and the biological clock, which is our circadian clock, which needs environmental signals called Zeigerbergs, I think is the correct pronunciation, to synchronize its own rhythm in tune with the environmental one. Example of Zeigerbergs could be the light, the darkness, or also the artificial and blue light. And so, while historically people were only exposed to the light and the darkness of the sun and the moon, and so the biological clock was consistent with the sun and the social clock, nowadays we are exposed to other Zeigerbergs, such as the one of artificial and blue light, that have delayed our biological clock, creating a gap with the social clock, which is the social jet lag. To better understand this concept, let's make an example of a person who during work days goes to bed at midnight after maybe working or watching television and wake up at 7 because of work. But on the 3 days, this person still goes to bed at midnight, but wake up at 12. By watching these lights, it seems that this person traveled through several time zones, from work days to 3 days and to 3 days to work days. And so this discrepancy between the social and the biological clock is the social jet lag and is a circadian dysynchrony. And for this reason, the aim of this work was to investigate the impact of Mediterranean diet and social jet lag on the risk of severe liver fibrosis in individuals with NAFLD. Our patients was a cohort of 148 patients with a diagnosis of NAFLD by ultrasound. All of them underwent the assessment of liver fibrosis by FibroScan, where severe liver fibrosis was defined by liver stiffness values higher or equal than 8.8 kilopascal. All of them underwent the Munich chronotype questionnaire for sleep and wake behavior, which calculates the social jet lag as the absolute difference between the mid-sleep on 3 days and that of work days. And according to the median value of the score of the social jet lag, we define individuals with small and large social jet lag. And also, all these patients underwent the Mediterranean Diet Score questionnaire, and people with low and high adherence were defined by the median value of the score. Some data about the study participants. Briefly, the median age was 52 years old, the median liver stiffness 5.1, the median Mediterranean diet score 7, and 81 subjects have a large social jet lag. And as for the comorbidities on your right, most subjects suffers from dyslipidemia and arterial hypertension. According to the risk of liver fibrosis, we saw that patients with severe liver fibrosis have higher values of glucose, triglycerides, AST, and GGT levels compared to those with mild or moderate liver fibrosis. And curiously, the prevalence of small social jet lag was higher in patients with severe liver fibrosis compared to those with mild or moderate liver fibrosis. However, we saw that in patients with a large social jet lag, those with severe liver fibrosis have a significantly lower adherence to Mediterranean diet compared to those with mild, moderate liver fibrosis. And this result is in line with a study associating a large social jet lag with a lower adherence to the Mediterranean diet and a higher BMI in young adults. To achieve the objective of this study, we perform a logistic analysis for risk of severe liver fibrosis, and we show an interaction between social jet lag and the adherence to the Mediterranean diet. And particularly, in subjects with a large social jet lag, we saw that those with a higher adherence to the Mediterranean diet showed a decrease in the risk of severe liver fibrosis. And so, to conclude, we know that patients suffering from NAFLD exhibit impaired sleep quality, and that models integrating diet and social jet lag or sleep pattern characteristic may unveil potential pathogenetic mechanism associated to liver fibrosis risk in patients with NAFLD. But further studies are necessary to better understand the impact of sleep disturbances in the pathogenesis and progression of NAFLD. So thank you for your attention.